Occupational therapy practitioners may work with nurses in many settings, such as acute care, acute rehab, skilled nursing, and so on. When working with nurses, here are some things to keep in mind to maintain a good working relationship with them and to maximize the effectiveness of patient care, communication, and to reduce errors and negative feelings overall among the team. Nurses have what is called the golden hour. It is basically the time for med pass or for medications to be handed out to patients, often in the morning time and evening time. The morning med pass is more relevant for OT practitioners because by evening time, at least here in the US, most occupational therapists would be off work by that time anyways. The time that morning med pass occurs may differ based on the setting and facility. Just as an example, let's say that the med pass time for golden hour is say 8 a.m. to 9 a.m. Occupational therapy practitioners often like and need to check in with nurses before they see patients, and this is actually considered good practice. Personally, for me, at this time, I think it's good etiquette to minimize the disruptions for nurses as much as possible. That's not to say that we should bypass and avoid communicating with nurses during these time frames and just going to see the patient themselves, but just being more mindful of the nurse's time and minimizing disruptions, especially during this golden hour, I think is very important. This golden hour for nurses is a very narrow window to look up orders for medications, dispense the medications themselves, assuming they're there in the place they need it, and to actually administer the patients themselves to the patients. And there can be even more barriers to that for nurses. Not all patients may be up for the task. Sometimes they may be a little bit slower. They may have dysphagia, may refuse medications or be more difficult, and so on. This can add to the stress of our nurses. Oftentimes, these medications even have a very strict time that they need to be administered, such as for narcotics or analgesics. And if they are not administered, the drugs may need to be wasted, and nurses may even get penalized or flagged in the system for this happening. Another thing is that it takes a lot of concentration for nurses to dispense medications in order to avoid making mistakes, like giving the wrong medication to the wrong patient, giving the wrong dosage, giving too much, too little, missing doses altogether, and so on. While the following are not black and white, hard and fast rules, in my experience where I work and in talking with some nurses, here are some do's and don'ts of the nursing golden hour as an occupational therapist. Number one, do not disturb nurses when they are in the med room. Oftentimes, med rooms have a little peeking window, and you can see who is actually in there and dispensing medications. This place is like sacred to nurses, I think. Not only do they be on their A game for concentration, but it's also a little time for them to get away from the chaos that is our healthcare system and to have a little bit of peace. So I think it's a time and place for them to not be disturbed, at least for a little while. If the nurses you want to ask a question from are in the med room, it is considered probably good general etiquette to not disrupt them. And of course, if it's an emergency, then that would be a different story. I like to wait until they're finished if it looks like they're almost done. Of course, if you just see them walk in, they're probably going to take a long time. And that's time where you could probably be circling back to them and finding another nurse or patient to work with on your caseload. And one thing to note is in some places where you work, or even in some systems, the medication dispensers like the Pyxis machines may not necessarily be in a med room. They may just be out in the unit themselves. And of course, they're still locked up. So also pay a special attention to not be disruptive for nurses when they're working with their medication dispensing machines, regardless of the environment that they're in. Number two is do wait patiently for nurses during golden hour. I like to not initiate and interrupt them when they are, say, dispensing medications outside the med room, if that's the case. What I like to do is I kind of make my presence known, like I'm in their peripheral vision, and usually this alerts them that you want something from them, but it allows them the time to do what they are doing in terms of their sequence of tasks, say dispensing several medications. And then when it comes time, they often ask you, hey, like Jeff, how can I help you? If the nurses don't notice you altogether or just kind of walk past you, then I like to initiate and ask them questions or if I can see my patients and so on. Number three is do try to ask your questions for patients that you're seeing that are on their caseload. What I mean by this is try to ask all of your questions at once instead of coming back and asking them multiple times, especially for different patients when you could have done this all at the same time. This helps you to be more productive and efficient and actually help you reduce errors and provide you more of a big general picture of what's going on. For example, let's say that Nurse Joy sees 3 of your patients on both of your caseloads. They may say that patient 1 is still asleep, patient 2 is actually in surgery, and patient 3 just got up and is waiting for therapies. Well, because you asked about 3 patients from the same nurse back to back, then you know that you can say see patient 3 first because they just got up and they're waiting for therapy, then patient 1 next because they're probably going to wake up by that time, and lastly, hopefully you can see patient number 2 who will be back from surgery, or if they'll probably tell you, well, it's probably not a good day, you might want to see them tomorrow. So that can give you a good overall picture because you're one, very organized, and you save time by asking your nurse, hey, I have patient 1, 2, and 3, what's going on with them? And don't worry, this gets better with practice and time. It definitely took me some practice to getting used to this, and it really depends on how your day is going and how busy your caseload is because there are so many variables to this, but in general, that's one pro tip. One exception to note is that if the time that you've asked your nurse to see your patients and the time you actually go and intend to see them has been quite substantial, say several hours have passed since you've asked your nurse, say in the morning, then you probably want to check in with the nurse again briefly because, especially in acute care, things can change really quickly and rapidly. You know, they may even be discharged and you may not even know. So definitely check in if a lot of time has passed since you've talked to the nurse last. Number 4 is don't page or call your nurse too often or unnecessarily, especially if they're just nearby. And many places where OTs work, such as in the hospital setting, the team, including you, the occupational therapist, may get a phone or a paging device that allows you to directly call the staff, such as the nurse's extension directly on the phone that they are carrying for that day. This is, of course, good and bad, right? It can be a good tool for communication, but as we all seen with doctors being paged all the time, it can be kind of disruptive as well. For example, where I work in the acute rehab unit, there are, say, 2 or 3 nurses for the whole unit for all the patients that are in like a 15, 20 bed unit. So it doesn't really make sense to, say, call the nurse when I know that they're going to be somewhere around. If they're not going to be, say, at the nursing station or doing med pass in the med room, they're probably going to be with the patient in the room that's probably like a few steps away. So I like to just kind of go, walk down the hall and, oh, there they are. And oftentimes they may just be standing by the doorway anyways with their computer on the wheels. And, that's an easy way to get a hold of them because I think face-to-face communication is the best. It reduces the chance of error. You get to build rapport with your nurse, and it's just easier cognitively instead of just not working with and seeing someone there through communicating with the phone. And I think a lot of things can get lost, like they may not hear you, words may get missed, and so on. So that's my tip, if especially the unit is small and it's easy to get a hold of the nurse. Of course, that's not to say avoid using the phone altogether. If you can't find your nurse, say you can't see them with a brief scan of the unit, then, of course, give them a call. What I like to do is when I first get on the unit, say in acute care, I look at the whiteboard and put on my list of my caseload for each patient, which nurse is responsible for them. And I kind of group the nurses kind of along my previous tip of grouping together. And you can use like highlighters if you want. You can get real fancy with it. But basically, by being organized, and then you can go plan from there. Say you look and you see, oh, Nurse Joy is just right there. I'm going to go ask them right away. But I don't see Nurse Bob. Well, you can probably give Nurse Bob a call after you talk to Nurse Joy. So this kind of goes with practice, and it's not a hard and fast rule, but through more practice, you kind of get really effective with communication. And I think this is a communication skill that you can build on. The more you practice and work with it, the easier it'll get. And by looking at the whiteboard in the beginning, oftentimes many units even write the nurse's break time, such as their lunch time, on the board. So through some really easy detective work, you can quickly see that, say, Nurse Joy is actually on break, so there's no point in calling them. Another great resource you can use is by talking to the charge or head nurse for the unit. They often know what's going on with all the nurses, and they can say, oh, Nurse Joy is on break, so there's no point in calling them, but how can I help you? And, you can talk to them directly. Of course, every unit is different, and each unit may have its own type of culture, so you kind of get the feel for it as you go there and work with them more and more, and things get easier. And my last overall tip for communication is to try and have a positive attitude and outlook. Of course, this goes with everything in our OT practice, but I definitely sympathize with our nurses during these difficult times in healthcare overall, as they're doing so much for our patients during the pandemic and their families, and facing things like staff shortages, lack of support, patients getting ill and dying, and it's really tough. By being supportive and understanding of their role, it can go a really long way in making the team and healthcare system flow. Definitely don't take it personal if nurses seem like they're too busy to bother, they're a little rude to you, or whatever. I think that my number one asset is basically my attitude and how I not only interact with patients and families, but the overall healthcare team. I think every interaction I kind of treat it with a positive attitude, and no matter how the other party is, I try to make the best of it and go from there. In regarding communication, everyone has different preferences, right? Some like face to face, some may be more outgoing, extroverted, some may be more introverted, some don't mind being paged, some love getting questions and seeing their OTs getting their patients out of bed. So everybody's also very different. So I think that's the beauty of working in healthcare. You can get so much diversity in all aspects of the job. What do you think are some do's and don'ts in working with nurses, especially during the golden hour? Let me know in the comments. I'm Jeff, the OT Dude. Thanks for watching and have a nice day.